Hello and welcome. I'm your host, Neil Howard. Thank you so much for returning for another segment of Health Professional Radio. In this segment, we're going to be speaking with returning guest, Dr. Ernest Grant. Dr. Grant is joining us here as president of the American Nurses Association, part of an educational flu campaign called Not Today Flu. Welcome back, Dr. Ernest Grant. Thank you so much for returning this morning.
Well, thank you so very much for having me.
Of course, I mentioned that you are president of the American Nurses Association. Give our listeners a bit of your background and talk about being the president of this organization.
Well, I'm fortunate enough to be the elected president that represents the nation's 4.3 million registered nurses. And part of what we do is, in addition to advocating on behalf of nurses, but also public education and regarding health and healthcare issues, and also advocating for the public as well. So obviously, you can imagine it's a pretty busy 24/7 job, but one that I truly love.
Is this year's flu season anticipated to be worse or the same as any other that we've ever seen? What do we know so far?
We are anticipating that this year's flu season will probably be worse for a couple of reasons. One, the last 2 years, everyone has been so diligent, either, washing their hands, wearing masks, keeping social distancing. And those are the things that, help to prevent the spread of the flu. Of course, we're locked down with the pandemic, so no one was moving around. But now that the country is opening up more, we are seeing that people are not, wearing the mask as much. They're not being socially distanced. They're not washing their hands or sanitizing their hands as rigorously as we have been over the last 2 years. So, so we are anticipating that will lead to an even greater occurrence of the flu. And in fact, as of last week, according to a report from the CDC, there have been early incidents of increase in the flu, particularly in the southeast and in the mid-central portion of the United States. So we're already seeing this, and this is just the beginning, the middle of October. So we can pretty well anticipate that that's a pretty good indication that is going to be a pretty exceptional high flu season this year.
It seems that there's a mindset. We got through COVID, so we don't have to worry about anything else. Nothing else is really on that scale. So if we get through COVID, we can get through anything.
Absolutely. The first thing people need to understand is that the flu and COVID are two separate viruses. Yes, there are vaccines available for COVID, and there are vaccines available for the flu, and individuals should get both. But just because you have one, and I know a lot of people, even though they may have the same symptoms, a lot of people think, one shot should take care of all of that, and that's not true. They are specific for each one of those particular illnesses, and that's why it's so important that people do get their flu vaccine. Actually, should have gotten it yesterday. As we head into the flu season, it's vitally important that they do that. Particularly, we know that there are some people who are at high risk. Those with pre-existing conditions that may have respiratory problems, older adults, people like that are ones who especially should get their flu vaccine as soon as possible.
Tell us a bit more about some of the complications that the flu can cause, and how do practitioners get that conversation started? You just mentioned how important it is and the reasons why, but how do you get that conversation started with a patient who may think that they're just not at risk?
Well, you get the conversation started by just talking to the patient. A lot of times it's a fear that they have. I'm sure that your listeners can identify with themselves or a family member who said, "Well, I took the flu shot at one time and I got the flu, or it made me sick." But what they are failing to realize is that the flu shot does not give you the flu. What it does is it increases it sort of stimulates your immune system so that, a little bit of aches or fatigue or whatever that you were feeling, that's indicating that the shot was working. And both of these shots, both the flu shot and the COVID shot, are designed, if you will, to that if you were to catch these viruses, you would have a less severe case than if you were unvaccinated. So that's how you get the conversation started with those individuals, and of course, pointing out the fact that if you were to get the get the flu, some of the severe complications could be either respiratory problems, people who may have pre-existing conditions such as diabetes, hypertension, things like that. Those conditions could be exacerbated or made worse. And possibly even putting the person in the hospital as a result of that as well. So that's why it's best to err on the side of staying healthy by getting the vaccine as soon as possible as we head into the flu season.
Is it as simple as going to your doctor or your pharmacist and just asking for a flu shot, or are there subtle differences that patients should be aware about and possibly ask about?
There are some differences in the shots, but it depends on mainly having that discussion with your doctor or your provider, if it's a nurse practitioner or PA or even a pharmacist. Sitting down and discussing that. We know that, say, for seniors, there's we pretty well want to give them the high dose, flu vaccine, which is shown to be much more effective. And then for those younger, usually, what is recommended 6 months and older are individuals who can get the flu shot. But it also depends upon their prior state of health. And of course, for some people who may be allergic to eggs, then there's another version of the flu vaccine that can be used. So this is why it's so important to sit down and have that conversation so that your healthcare provider can decide which is the best one for you.
There are folks who've gotten several, maybe as many as 4 COVID-19 vaccines over the past year, maybe a shingles shot, and maybe even a flu shot. What about people that are concerned about taking these flu vaccine or these vaccines at the same time? And what about people that are just tired of taking vaccines? Maybe the whole population is just tired of vaccine this, vaccine that.
Well, you're certainly right, but the flu vaccine can be given in conjunction with the COVID shot or vaccine as well. Yes, but the thing is, though, is that you want to arm yourself with the protection of knowing that you're going through these critical winter months when the flu is going to be prevalent. We're anticipating that there may be an increase in COVID cases as well, as we're seeing different variants of that come about also. So I would encourage your audience to err on the side of precaution and protection, and get the vaccines, and that way they know that they are prepared to go through this season, as opposed to taking the chance of getting either COVID or flu or the two together, because we really don't want what we're trying to avoid is what we call a twindemic, an increase in COVID cases as well as an increase in flu cases as well, and people winding up back in the hospital, and we're going to see an even greater demand on the healthcare system, like we saw when COVID first came to the shores of the United States a little over 2 years ago, and totally exhausted the healthcare system in supplies as well.
Now, I did, of course, mention that you're joining us here as part of an educational flu campaign called Not Today Flu, which empowers people to get their flu shot, which is exactly what we've been talking about this morning. Where can our listeners learn more about the flu shot and about this campaign?
Well, your listeners can go to the web of nottodayflu.com, and there are the whole wealth of information plus frequently asked questions and other additional resources that they could get. But that's the best place for them to go and get their questions answered. And if they have any further questions, again, they can also feel free to reach out to their healthcare provider and their pharmacist for more in-depth questions also.
Ernest, I appreciate your time once again. It's been a pleasure speaking with you. I'm looking forward to our next conversation. Thank you so much.
Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Ernest Grant. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.